Hello, I'm Challen the Edgy Skater, and today I wanted to make a personal vlog video to update you on how my post-op appointment went earlier this morning. I I realized that I haven't gone into the history of how my back ended up being in the condition that it was to need the surgery that I had. And this is not going to be that video today. But I think to better understand and to make anyone else with any of the medical conditions I'm about to read off uh, feel more represented, uh, I think I should just start with explaining a little bit from a diagnostic level what was wrong with my back. A very general explanation of what I had done, and then what the nurses today said moving forward. So I actually have um, the I have my physical therapy prescription behind me, and well, behind the camera, and on it it listed different conditions that warranted having what I had done. So I know that back issues, they are one of the more common problems in figure skating. And by all means, you don't need to be a figure skater to have any of the things I'm about to read off. But especially for standard track skaters and especially freestyle skaters, and I am only guessing this could be compounded in pairs. It's just my guess. These are some of the things that can be a problem after years of training very hard, very long hours, and it's even more of a possibility to run into anything like these if you neglect off ice. It can happen regardless, but not having proper off ice, not having proper nutrition isn't going to help with anything on this list. And I guess the first thing I'll start with is most of my back issues were it's L5, S1. So lumbar, fifth vertebrae. Um, I gotta make sure I get my words right to pronounce it correctly. Sacral first vertebrae. So this is very, very low in the lumbar back. When we get into sacral, we're starting to get into the things that make up the very final vertebrae, with tailbone being the last one. So, first of all, unbeknownst to anyone, I had a genetic pars defect in that area that helped set the stage for everything I'm about to read off. This is a pars defect in the joint, so from birth onward, this is something that developed in utero. I was already set up to have a pretty major uh, lower back instability. So, the other things over the years that I'd been diagnosed with were lumbar spondylosis, uh, lumbar spondylolisthesis, spinal stenosis, and degenerative disc disease. And again, this is all in the lower back, primarily at L5S1. Like I said, I'll save more of an origin story for another video. But after putting off any sort of surgical intervention, which had been recommended, the better part of 20 years ago. I finally had found a surgeon that I trusted well enough, and things had gotten bad enough that the idea of putting off surgery on every level was no longer a uh, functional option, or even a pretend to be functional option. So, what I had done was a spinal fusion at the L5S1 area, because by this time, and because of that joint defect, and because of other stress fractures and a completely broken off bone in the area, and the damage to the disc between those two vertebrae, um, it was barely even 50% there, if that, by this point. Um, no other type of spinal surgery would have been an option. And the nerve damage after all of these things progressing over 2 decades was so extensive. It required a very large amount of bone shaving to try to release pressure off of. So I ended up getting a rather extreme form of a spinal fusion, and I had it done December 3rd. I actually just forgot what day today is. Today is the 5th, right? January 5th. This is my first post-op appointment with the nurse. In my next post-op appointment, I'll be able to speak with the surgeon directly. And I got the okay to get a physical therapy prescription. I just have to put it in at an office somewhere. An office that has a certain amount of sports rehabilitation program that are going to be able to help, because on top of wanting to rehab it in general, I had many years as a freestyle skater, a single skater, but by trade, technically, my competitive career really was based as an ice dancer. So at some point, my goal is to be able to get back into an elite ice dancing competitive level um, by standard track standards, even though I'm an adult, and I would need to have the ability to lift people. So we estimated that it's going to take about 18 months. Well, now just under 17 months to see how the physical therapy is going, how the different bone grafts um, fuse, if the hardware all stays in its proper place, which we are expecting, of course, but we want to be very careful and make sure. And I don't do anything between now and then to alter that course, because I am known for being very klutzy off ice, but we won't put that energy out there. Um, my goal is to in time. I hope to get on the ice next fall, or this coming fall. Best case scenario, if I have to put it off longer for rehab, of course I will. I'm not going to push it. But my next goal for the following 3 to 5 years is to get up to the level of ice dance I was in before, and to surpass it. That is the ultimate goal. And I know that the physical therapy probably is not going to be fun every time. Um, when you have major surgery, sometimes it isn't always fun. I'm actually more concerned about the ankle sports rehab, just because that is something that doesn't exactly like physical therapy, and had uh, almost 3 months of physical therapy before I went in for the back surgery. So I already know it doesn't like it. To be honest, if I don't do anything silly, I'm not expecting the back rehab to be as difficult as the ankle. But I should have full range of motion of my back for everyday things, and I should have a work withable range of motion for my back for partner dice stance. And the ankle, I was told, is going to take a similar amount of recovery time. It's probably going to need extra. There's probably going to be a certain amount of maintenance, special rehab things that I'll do for it forever, compared to what the other side needs. But I was told that the range of motion I had before should, for all physiological reasons we understand, be able to be restored. And it's a bit rusty, so I actually need to get it better than it ever was on both sides, and that should be possible. So, wish me luck on this journey. I will make a more detailed origin story video for both my back and my ankle separately. The ankle's honestly more of a kind of a almost funny story. Um, Backstory is just kind of sad, but I figure it's important either way to put it out there, because I'm sure there are some adult skaters who are coming in that know they have these conditions, at some point may discover they have any of these conditions, or maybe are already taking up adult skating after having some sort of a major surgery, or at least a major surgery recommended to them. And I am very happy to talk about my experiences with either surgery, what my thought process was to finally get them, how I felt comfortable going with the surgeons that I went with, and I will try to document on here um, what the rehab experience is like, with more specifics to exactly what I've done, so that hopefully it can be encouraging for someone else, but also give everybody a realistic idea of, when you have exactly the scenario I had, what that kind of rehabilitation for sport and hopefully more serious sport uh, can look like. Without just being injured in one video and then back to a very competitive level in another. But I'm not going to fill up this channel with vlogs about it, of course, but to have a reasonable progression of, oh, this is really what that kind of takes. It's not fluffed up in any way. It's not fast forwarded too far. This is just kind of what that process looks like, hopefully without being boring for viewers. So again, wish me luck. I will keep you posted. I hope you have a good day. This video finds you well and you have a good skate.